Are clinical trials an option in treatment, relapse, or failure?
So the first answer is that clinical trials should always be considered for all patients with acute leukemia. We are delving and trying to improve the survival of patients. And this is only achievable realistically by performing clinical trials. And unfortunately, the actual participation of patients in clinical trials is very low. We're lucky if we get about one in 4 patients who have a diagnosis, a new diagnosis or relapse disease coming into clinical trials. So the importance then is as following. The one is for the patient itself. So when one participates in a clinical trial, it's like following a cookbook, a menu, if you want, or it's more a menu on how to cook a certain dish, if you want. You follow specific steps, and those steps are required to be done at specific times. And the best sort of steps that are put into these protocols so that nothing is missed. You do not want to miss the disease from relapsing, and by missing a bone marrow and saying, oh, well, instead of we're going to do a bone marrow next week, we'll do it in 3 months' time. And so patients who participate in clinical trials are observed very much more carefully on the whole than those who do not. So that's an important step. And they have all the requisite tests that should be done according to the menu, if you want, that's been followed. So important step for the patient. So things aren't missed, tests aren't missed that should have been done, or they are done at the appropriate times and not at delayed times. So all important features, and usually patients are followed more carefully, very much more carefully, if they're participating in a study than if they're not. So important is the concept related to that. So it's important to try and improve the treatments that are used to induce remission in patients, like at the initial diagnosis. Can we do better? We don't get 100% of patients or even 90% of patients into remission at the beginning with our intensive chemotherapy regimen. So we always are trying to get better. And similarly, and I'm now going to concentrate and talk about the older patient, the survival and the time to relapse in older patients has lagged behind significantly younger patients with AML. And it's been a really battle to try and improve the survival of patients over the years. Over the past 50 years, we've made some inroads, especially for younger patients with AML. But in older patients, it's been a very difficult road, but it's getting better. As more patients participate in clinical trials, and we try different treatments that hopefully will improve the responsiveness of the leukemia to the treatment. So important. So that's for all patients with AML, then it will benefit eventually by participating in trials. So 2 things again. It's beneficial for the patient to participate. And then secondary is it's also will be beneficial for all patients who come after the patient with acute leukemia, and we will be able to make better decisions about what treatment to use based on their performance or their participation, I should say, in clinical trials. So cannot stress this high enough.